Hello, everybody. Welcome to MS Neuro TV. We have a lot of people joining us tonight again, and we're so happy to have you. But as you all log on, just to introduce myself, my name is Jennifer Falk. I am the Director of Development. We would like to thank our sponsors, Novartis and Bristol Myers Squibb, for supporting programs like this and making things like this possible for the MS community. We thank you. And today we are here with Dr. Gretchen Hawley. Dr. Gretchen is a doctor of physical therapy and a multiple sclerosis certified specialist. After graduating from Simmons University in Boston, Massachusetts, she developed an MS physical therapy program alongside two of the city's top MS neurologists. Dr. Hawley utilizes the concept of neuroplasticity in her online MS wellness program called The Missing Link to help her clients reduce fatigue, get stronger, improve their balance, and walk better. Her clients feel more energized, empowered, alive, and more like their normal self again. Dr. Hawley has been a keynote speaker at several MS conferences, lectures, and frequently for MS support groups, and continues to keep herself up to date in the newest and best MS practices for attending the MS Consortium each year. So we are very excited to have Dr. Gretchen join us tonight. And before she comes on the line with us, we're going to play for all of you a pre-recorded interview between Dr. Gretchen and myself that we did some months ago. And we hope that you enjoyed this recording. And you can start typing in your questions for Dr. Hawley. Even as they come to your mind, as you're watching this video, you should see the question box on the top of your screen where there's a little orange arrow. And I did receive many of your questions in advance, so I have those lined up as well. And we're just very happy to have all of you on the line tonight. It's an impressive amount of people. So again, welcome. And Bill, we'll get started with that video. Dr. Gretchen, welcome back to MS Neuro TV.
Yes, thank you for having me.
Absolutely, thank you for being with us. Today we're going to go in a bit of a different direction and talk a little bit about access to physical therapy. Many people have challenges in terms of their insurance and what is covered. Maybe you can share with us in general what you have seen a person living with MS, how often they are authorized to get physical therapy, or how they get to come to you as a physical therapist.
Yes, so the number one way that people come to me is their neurologist or one of their doctors gives them a referral to go to physical therapy, which is great, but I do just want to point out too that sometimes all the time, you can ask one of your doctors for a referral. I have had some clients who unfortunately say that they've told their doctors, their neurologists, that they've been falling, and the neurologist never told them that they should get physical therapy, so they asked for it, and then they wrote them a referral. So it can go both ways, where the doctor refers you, or you can ask your doctor. And there are several insurance companies in states that are now allowing direct access. So you don't always need a referral in order to get physical therapy, which is great. You could essentially just walk right on into a physical therapy clinic and make an appointment for yourself. So you'd have to check with what state you're in, what your insurance company is, but direct access is becoming more and more of a common thing. I know the American Physical Therapy Association had a goal that in the year 2020, everyone would have direct access, which they're not there yet, but we're working on that.
Oh, that's great. Mm-hmm. I remember there was a time where maybe you'd only get 7 sessions or 10 sessions, and then that was it for the year.
Yeah, there are some still that allow 6 or 7 sessions, 8 sessions, and then others I would say go up to about 20. Some go up to 60, some don't really care too much. The biggest thing to note though is that as long as your physical therapist can prove that it is medically necessary, that if you were not continuing with physical therapy, you would decline, most insurance companies will give you more visits. And some unfortunately still have a hard cutoff, but at least with Medicare in 2018, they passed a new rule that as long as it's medically necessary, they will allow more visits. So talk to your PT, and if they are on the same page as you and understand that, yes, you need PT in this moment, then you should be able to get some more visits.
That's excellent. Great information. Thank you. So, Dr. Gretchen, is there an age or type of MS or a level of disability that comes into play when considering how often you should partake in physical therapy?
Not necessarily. When it comes to how often you should participate in PT, I would actually say it'd be the same for everyone. What you would be doing during your physical therapy session would be very different based on if you're going through a relapse, your age, what your symptoms are, what your goals are. So what you're doing in those sessions would be different, but I think the frequency at which you go to PT should still be the same.
Okay, and so say you're a person diagnosed with MS and you don't really present with any physical challenges or disabilities. Do you still recommend getting assessed by a PT and participating?
Absolutely, because hopefully you are in fact telling the truth and you don't really have many symptoms at all. Your walking's good, your strength is good, everything's good, but what we do in physical therapy is take those measurements still. And then if years from now you feel like you've had a relapse or you just feel weaker and you want to know, am I actually weaker or is this just something I'm feeling right now? We now have a baseline measurement for all of those numbers, and we can give those to you so that if you move around or end up going to a different PT, you'll know your baseline measurements too. So getting those numbers can be extremely valuable, considering MS is a progressive disease and you may have a relapse or a progression at some point. We'd be able to measure that for you.
So get assessed no matter what.
Assessed
and
no
have
matter
that baseline. That's great.
Definitely.
Okay. And I know fatigue is a big challenge for many people living with MS. What do you recommend, or how do you recommend someone incorporating exercise, physical therapy while they're living with fatigue?
Great question, because some people don't even go to physical therapy because they know it's going to tire them out. So the first thing would be to assess, is it true fatigue? Are you actually wiped out from the exercises? Or is it potentially because your core temperature is rising, which can bring on any symptoms, fatigue being one of them. But if your core temperature is rising, it's as simple as when you get to PT, have them give you a cold pack that you can put on your back. Or some PT clinics will have a cooling vest, cooling wristbands, cooling hats. There's so many different cooling devices that you could wear during your physical therapy session. If it's not your core temperature though, if it is true fatigue, then you need to stop before that point. And this can be very tricky because for some people, they will feel fatigued in the moment, which is great because you know, okay, I should have stopped before then. But other people don't feel fatigued until the next day or later that day. And that's a little bit tricky because you get home and all of a sudden you are just wiped out. You were fine during your PT session. And in those situations, you really want to either remember or write down what did you do during that session, because clearly it was too much after the fact, and then during your next PT session, do a little bit less. Did you tolerate that better? If not, during the next PT session, do less, or exercise session, whatever it is. So you kind of slowly back off on those, but not overdoing it, stopping before fatigue. And the most important reason for that would mostly, as a physical therapist, I would say would be the quality of the exercises. With MS, your exercises need to be on point and perfect quality, otherwise you're training your brain for bad movement. So we want to stop before fatigue, stop before any other MS symptoms come on, so that you are getting good movement.
Okay, so if 30 minutes wiped you out the last session, I guess you would recommend starting to try 20 minutes and see if that wipes you out.
Yep, there's a couple of different strategies. That's a great one, where if 30 minutes was too much, let's try 25. Let's try 20, 15, whatever it is. But research has actually proven that you can exercise throughout the day. So when you're in a physical therapy session, you can't come and go throughout the day. It's just at one time. But schedule an hour-long session, and 30 minutes of that should be seated resting time. And just talk to your physical therapist about, I need to stop right now, and tell them what you need if you think you are fatiguing, and stop before that point.
Yeah, I like what you're saying about I need to stop, right? Recognizing,
yes.
Because there's this idea where in exercise or physical therapy that you need to push through.
Right.
And maybe you can talk a little bit about that push through and how that works for people.
Yeah, so most of the time when you push through, you're going to have bad form on the other end. You're going to be tired, it's not going to be perfect quality, and it just won't be the movement that you actually want to be training. So you should never, in my opinion, ever push through any type of fatigue or symptoms that you're feeling. And when you're exercising at home, keep in mind that you can exercise throughout the day. Research shows now that you can split up your exercise to morning, afternoon, late night, and it's just as effective as doing it all in 1 hour throughout the day. So if you have an hour and that doesn't fatigue you and you're fine with that, go for it. But if not, maybe do 5 minutes in the morning, 5 minutes at your lunch break, 5 minutes when you get home from work, and just split it up into moments that you can tolerate without fatiguing.
And just as effective.
And it's just as effective.
That's great to
I
know.
tell people now they can no longer use the fact that they get overtired from exercise or that they don't have time to exercise as an excuse, because research now proves it's just as effective.
I got to get to work.
Most of us do.
Okay. All right, great. Well, thank you so much, and thank you for sharing that information with us.
You're very welcome.
We're just back, and I wanted to welcome Dr. Gretchen Hawley. Are you on the line, Dr. Gretchen?
I am. Thank you for having me.
Oh, great. Thanks for being with us. We're so excited to have you on the line. And I feel like when we filmed that interview, it was a different world.
Yes. Oh, so different.
Yeah. So I'm glad to hear that you're doing well. We have a lot of questions. We have about 80 people joining us right now. Can you hear me okay, though? I hear a little bit of an echo.
I hear a small echo as well.
Yeah. Okay, hold on. Not sure what that is about, but how does it sound now? Any better?
That's better. Yep.
Okay, great. I'll take you off speaker. So we have some good questions coming in. I'm going to read the ones that came in first through email. And there's a general question someone's asking, what is the best exercise for MS patients?
So that's a great question. I probably get asked that on a daily basis. And it's somewhat of a tricky question to answer because the best exercise is going to depend on what movements are hard for you to do and also what your goals are. If you have a goal of walking better and the reason you're walking isn't great is because you can't lift your leg, then an exercise that I call marching might be the best one for you. Or if one of your biggest limitations is drop foot, then ankle dorsiflexion might be great for you. So it really depends on where the weakness is and what your goal is. So unfortunately, there is not one best exercise. I will say if you do have a goal of walking better, my personal favorite exercise is called exaggerated walking. And basically, it's just walking, but exaggerating every single movement, because when you put that much effort behind it, typically what happens is to people watching, it just looks like you're walking normally. But to you, you feel like, oh my gosh, I'm putting all this effort in, but I'm not dropping my toe or I'm bending my knee more. So if it's walking, I would say exaggerated walking, but it's really dependent on what your goals are.
Okay, great. Thank you. And I have someone else that's writing in that is saying that my MRIs haven't changed over the years, but my disability has progressed significantly. Can you explain why that is?
So when it comes to muscle strength, and especially with disability progression, even though your MRIs haven't been changing, what often is happening is that neural pathway, which means the nerve that goes from your brain to that muscle that you're trying to get stronger, assuming in this case that disability means weakness, that connection is weak to begin with. And if it's weak enough and you're not practicing the right exercises, then it's not going to get stronger because the MS lesions that maybe were there in the past or are active there still, they're preventing that neuroplasticity from happening. So it really does require, MS requires that you do exercise consistently, because if you don't, then neuroplasticity won't happen, meaning your muscles won't have any hope in getting stronger if you're just hoping that your disease will get better with time.
Okay, so I know you mentioned neuroplasticity, and I have a lot of questions about that, but to follow up with this last question, they're asking, so is it possible to regain back function that has been lost?
Yes, absolutely. And so much research shows that. A lot of people think I'm just a really optimistic person saying that, but research proves that neuroplasticity does occur in people who have MS. And just to briefly review what that means, neuroplasticity is the ability of your brain to find a new pathway to go from your brain to the muscle that's trying to get stronger. So if you practice a movement time after time after time, every time you're practicing, your brain is trying to find a pathway that will work. And once it does, that pathway will get stronger. So going back to that last question as well, if you're not doing the exercises, or even if you are exercising but it's not the right ones, that neuroplasticity won't work, and that would explain why you would be continuing to get weaker, because you're not doing the work it takes to get your brain to find that new pathway.
That's so interesting. And so for MS specifically, I know that your work as a physical therapist is for multiple sclerosis. Someone is asking, is there a way to find MS certified physical therapists? Is there a search engine or like some kind of place someone can go to find that in their community?
You know, I wish it was a little bit easier. I will say that. You can find them. It's hard to find all of them. One of the best resources that I have found is specifically the MS Society. They call them care partners. And what a care partner means for the MS Society is it's typically a clinic that includes a neurologist as well as an MS specialized physical therapist. So that would be a great place to start, but I would also suggest calling PT clinics around you and ask if they do have any MS specialists that are there. At least in the areas that I have worked, they're not super common, which is very unfortunate, but it's worth asking about. And I just want to point out too that neuro specialists that are physical therapists is a different thing. It's not the same as an MS specialist. It's a much more broad specialization, so it's not specifically all MS. So it is a little bit better if you can find MS specialty versus neuro, but neuro would be better than orthopedic. And you could also look at the consortium of MS centers, the CMSC. They do have an area that you could find MS specialty physical therapists there as well.
Okay, great. That's excellent information to know. So if you can't access an MS specialist, the next best thing is someone that specializes in neurology or neuro specialist in PT.
Yes. Yep, and there tends to be more of those.
Okay, great. And you're always online too with your program as well. We could access you that way.
Absolutely. Yeah, I have two different things now, and because of COVID-19, I started doing telehealth physical therapy, and I know that a couple of other PT clinics are doing that too. So I'm licensed in Massachusetts, Maine, and New York, so I can treat people via telehealth there. But that could be another question, that if you do find a telehealth PT in your state that you live in, then see if they're doing telehealth, or if you find an MS specialist PT, then you can see if they're doing telehealth as well. But yeah, for the people who don't have access to an MS specialist, that's why I created my online program as well.
That's wonderful. And so telehealth is really limited state by state, wherever the practitioner is licensed to practice through telehealth.
Yes, for physical therapy, yes.
For physical therapy. Okay. And okay, I have somebody that's asking, does physical therapy need to be back to back? Like, for example, 10 sessions straight, like every week, or they still need more? I'm sensing that they have 10 sessions allowed. They're on Medicare in Illinois, and it sounds like they only get 10 sessions. So should they do it back to back, or should, I guess, she spread that out?
Every PT is different. My preference would be for sure spread that out, because 10 sessions, if you do that back to back, that's maybe 8 weeks. If you're lucky, maybe a little bit more than that, but that would be, I think, a disservice, especially because MS is a progressive disease. If you could maybe do one every other week or maybe one every 3 weeks, that will give you more than enough time to learn a bunch during the PT session, go home and practice it. And then when you come back, you can report on if the exercises are working, if they're too easy, if they're too hard, or maybe get new exercises because you've advanced to the next level. So if anyone is ever limited by PT sessions and there's nothing that you can do, like insurance is saying, absolutely, you can't say anything to change our mind, we will not give you more visits, then I would say try to spread them out as long as you can, while not so long that you're not seeing any improvements.
That's great. It's great advice. And I wonder if even you could possibly record your PT sessions so you can kind of work on them at home and see what was done during your session.
Absolutely. It is not uncommon for my patients to have me record them doing the exercises with my voice
Mm-hmm.
explaining the directions. And then when they get home, they can rewatch it and they're watching themselves do it and they can hear what the technique is supposed to be. And they also come in with notepads and they're taking notes during the session. And I am all for that, because the more you can retain, the better you'll do at home. So if there are any strategies you think would help you during your sessions, don't be nervous to ask your PTs if you can do that, if you can record them or if they can record you or take notes.
That's amazing. Thank you. So during your interview, we discussed a little bit about what's covered, and someone's asking, will insurance pay if you're just maintaining rather than showing improvement?
That is a great question. So typically, no, which is why your PT that you're working with they have to be a good note writer. I'll put it that way. I, you know, I would say it's typical for the patients that I treat to get maybe 16 visits or so. And then typically we'll do a reevaluation and they'll maybe give us 4 to 8 sessions more. And that's usually when it starts dwindling down. But with the notes that I write, I try to specialize or not specialize, what's the word I'm looking, specify what you're doing that's working and how you are improving, but also what's not improving yet, because you do need that component that shows that you haven't met all of your goals and that without PT, you might either decline or you would be a safety risk, like maybe you're still tripping or falling. So it is important to include that. There are some insurance that do allow habilitative services, which is different than rehabilitative. So basically rehab versus just the HAB. So you could look into your insurance and see if they offer that, but most insurances don't. And therefore, it is important to go on PT breaks, if you will. So maybe you're getting PT consistently, and then you take a month off, or maybe 2 months off, and then you come back and you reevaluate and you do some more, and then take another break. So it can be split up that way. Insurance companies tend to prefer that versus just continuous.
Okay, but that doesn't mean you break at home. So
Correct.
still do things at home as well. Okay.
Yes, always things at home for the rest of your life. We all should be doing that, MS or not.
Okay. Always keep moving. So there's another question here. Can neuropathy be reversed?
So neuropathy is an interesting topic, if you will, with MS. There is something called desensitization, which is an exercise. I refer to it as an exercise. It's more of finding things around your home that actually bother your sensory issues, and you try to desensitize the area that is bothering you. And there's mixed research on that. Research does show that it can improve sensation. But when it comes to multiple sclerosis, if the issue is coming more from the nerve itself and the damage of the nerve, there is not a bunch of research yet proving that this desensitization will absolutely work 100% and you'll be able to fully get back to your normal sensation. But those exercises are something that can help improve your sensation.
Okay, so desensitization. All right, wonderful, thank you. And I have another question I wanted to follow up with you on. Just a second. So can you discuss a little bit the role of exercise and preserving or enhancing cognitive function?
Yes, and there are so many different areas of cognitive function. So the first thing, if you are ever talking to your physical therapist or any of your doctors about cognitive function, be very specific about what cognitive functions. Is it word finding? Is it forming sentences? Is it doing two things at once? That is the one that I run into most as a physical therapist. So the thing that you do to train that, similar to desensitization, is you do the exact thing that's challenging for you. So what I would typically do, if the person I'm working with can walk, then I will have them walk and I'll have them say as many names as they can that start with the letter B. And they just keep going. I tell them to keep going until I say stop. Or sometimes people are actually really good at finding those words. So instead I'll say, walk forward and count down from 100 by threes, which even for me, like, that's really, really hard to do. But it doesn't even matter if you get the numbers right. The point is you're just doing two things at once. You're thinking about something as you're walking. And there's a bunch of different strategies like that you can do. But there's also a lot of research proving that if word finding is an issue, or forming sentences, doing some type of puzzle can actually make a big difference. And the last thing I'll say too is they do have cognitive therapists as well, and they have a whole bunch of strategies to help improve cognitive function.
That's so great. And you actually answered so many questions all at once with other people that were actually asking questions about word finding and verbal fluency. So that's wonderful. Thanks, Dr. Gretchen. Let me see one right here. People are asking, in terms of spasticity, how can they improve hamstring response and how can they build up their legs more?
So I'm going to answer that as two different ways. So we'll talk spasticity first.
Okay.
Spasticity, it depends where it is, because for some people, maybe it's in your quads, which are on the front of your thigh. And if your quads are spastic, basically your knee will stay straight. And for other people, it might be in the hamstrings, which are on the back of your thigh. And if your hamstrings are spastic, your knees will stay a little bit bent. Or maybe it's somewhere else. There's a bunch of different places that spasticity can be. So there are some type of stretching techniques, as well as maybe foam rolling and or using a handheld roller. But with spasticity, there are 4 different levels. Number 1 is the least spastic, and number 4 is the most spastic. And with number 4, there is nothing that you can do or that I could do to try to bend that leg or to try to straighten it, depending on where it's stuck. It will just stay where it is. So stretching can be effective for grade 1 spasticity and sometimes grade 2. And research is now showing that prolonged stretching is best. So instead of just maybe a 30-second hold, it can actually be held for up to several minutes at a time. And that would be more effective to reduce some of the spasticity. And massage can always be a technique as well. Spasticity is a tricky one, to be honest. So my best advice is try a bunch of things. Try stretching and make sure it's the correct stretches for that muscle group. Try foam rolling. Try using a handheld roller. Try a massage. Try acupuncture. Try it all and just see what works for you. And moving on to the second part of that question for hamstring response and getting the muscles stronger, the best thing to do, first and foremost, is do an exercise that targets that specific muscle group. So because someone said hamstring, I'm just going to run with that. So your hamstring muscles are responsible for bending your knee. So you need to be able to bend your knee in order to walk forward, in order to climb stairs, and really in order to change your position when you're sitting down or to get into a car. So you need it a lot. And one of my favorite exercises for that is in a standing position, and you're holding on to something for balance, and you simply just bend your knee. Try to get your heel to come up towards your butt as high as you can. For some people, you'll try that and you'll say, oh my gosh, that didn't move at all, like literally not even a centimeter. So then try it in a different position. You can do that same exercise sitting in a chair, put something under your foot so that you have a slippery surface, and bend your knee. If that still is challenging, you could even do this exercise lying on your back or lying on your side. So in terms of how to improve hamstring response or really any muscle response, know which exercise targets that muscle and then choose a position that you can do it successfully in and repeat that until it gets stronger, and then try it in a different position and move from there.
Okay, wow, that's great. Thank you, Dr. Gretchen. I'm going to close with this final question. It's a little bit more specific, but I think a lot of people can relate to this. A person is writing that my husband has been experiencing an increased amount of symptoms because of summer heat, and I'm wondering if physical therapy could ease this discomfort or actually add to his stress. And then her second part of this question is, when should she discuss with her physical therapist once it is safe to leave the house during COVID? Like when would it be safe to return to PT?
That's a great question. So for the first part of that, if physical therapy would ease the discomfort or add to the stress, if symptoms are worse because of the heat, the best thing that you can do is to cool your core temperature down. And the way that I suggest doing that, first and foremost, is to sip ice cold water. That is going directly into your body where your core is too hot. So cooling your core temperature down by ingesting ice cold water can be very helpful. There are also a ton of different cooling products out there. They have just clothing that can help keep you cool. They have hats, wristbands, vests. There's so many different things. And if your core temperature doesn't cool down, physical therapy would not ease the discomfort. It would, in fact, it probably would add to this stress. Any type of exercise, not just physical therapy. So when I am aware that one of my clients has heat intolerance, as soon as they come in the clinic, I give them a cooling vest to wear, just proactively. And then we start exercising. So we're trying to cool their core temperature down first so that they can exercise, and that will ease some of the discomfort that they're feeling if it's tightness, or they can work on their strengthening, whatever the goals are for that session. And for the second part of that question, that's a tricky one, because it's going to have to be partially when you feel safe. If you don't feel comfortable leaving your home to go to a physical therapy session, then I would say wait until you feel comfortable. I would also call the physical therapy practice and ask them what strategies are they implementing to help with safety and for keeping everyone safe during this time. And hopefully they'll list off a bunch of things that they are doing, but you could also ask them for telehealth PT if that's something that they are offering. In terms of leaving the house to go to a PT clinic, you could also ask how many other people will be in the clinic at the time of your session, because every clinic is different. Sometimes there's only 1 or 2 physical therapists working, meaning there might only be 4 people there when you're there. But other times there might be 6 PTs working. And if you go to a clinic where the PT has 1 or 2 patients at a time, that could be 20 people easily. So those are the questions that I would personally ask before you would consider leaving and feeling if you're going to be safe with going into the clinic.
Oh, well, thank you so much, Dr. Gretchen. It is always amazing just to listen to you. You always bring so much information to all of us, and we're really grateful to have you here with us this evening. Thank you.
Of course. Thank you for having me.
Of course. And just in conclusion, again, we want to thank Dr. Gretchen, and we want to thank all of you who have joined us tonight on MS Neuro TV. This has been incredible questions, a lot of activity, and we're just so glad to see everyone so engaged right now at a time that we can really all end up feeling a little bit isolated. This is a great time that we all come together and kind of really shoot it out and get some questions answered and get together. So we do this every month. Next month, our topic is going to be women and MS. We're going to talk about family planning. We're going to talk about pregnancy, relationships, intimacy, menopause, all of these things that are still happening even through COVID-19. And we're going to be doing that with Nurse Connie Easterling. So she's also so wonderful, and that'll be a great talk next month on August 18th. So I look forward to all of you joining us then. If you're registered for this tonight, you're registered for the entire series. So you won't have to register again. You'll just receive the reminders for the next event. So you're good to go there. And we also want you to know that all of these webinars, including tonight's, will be recorded. You'll be able to find it on our YouTube learning channel. If you go to YouTube and look up MS Views and News, you can find it there. This one will be posted within the next week or so. We hope that you'll subscribe. That way it will alert you every time we release a new program. And you can also find us on Facebook, Instagram, and Twitter. And our website is www.msviewsandnews.org. And again, we'd like to thank our supporters, Novartis and Bristol Myers Squibb, for supporting programs like tonight, and for all of the people who attended. Thank you, and we'll see you next month. Have a good night. Bye-bye.